As you know, Amsterdam has always been seen through the years as a very liberal city. If we compare that with the drug use in the early 60s and late until the late 60s, you had a lot of movement of drug users who were kind of seeking a kind of drug asylum, a place where they could feel free to use their drugs without the persecution of, let's say, the government or the morale. People believed in the world, and especially in Europe, that Amsterdam was a free city, sex, drug, and rock and roll. Amsterdam had access to drugs, with all the VOC was in Asia, that meant marijuana, cannabis, and opium. All the law in the Netherlands is based on what we call the opium law, and that has to do with the war between British, Dutch, and Chinese for the monopoly of heroin trade in the world. And it started to become a concern, a health and social concern of living together, when massive amount of people were coming from abroad or from the countryside to the city to use their drugs in public places. Between 83 and 98, the official opening of the very first drug consumption room, many steps have been built by different partners to create a drug consumption room to tackle the problem of open drug scene and HIV hepatitis C contamination. So 86 is a very important year in Europe because many countries decided to adopt this decriminalization law. First of all, there are everywhere in the world, any drug consumption room, we are trying to reach the same main goals. Prevention of HIV, hepatitis C spreading, prevention of overdose, death related to drug use, and prevention or limitation of public nuisance. From those three main goals, one more is starting to become more apparent through the year, and that is tackling the loneliness of long-term hard drug users. Those are the basic goals that you will find in any drug consumption room. To guarantee those goals, we try to focus on three aspects within the drug consumption room who allow us to reach those goals. And those aspects are working on safety, hygiene, and stress-free environment. Safety of using. You are in a safe place. It's legal to use in our drug facility. It's safety. You are under supervision of professionals. In case something happens while using, the first aid is guaranteed by the staff, and we have direct contact with the health authorities, ambulance, or professional who can do reanimations. Safety that there is some kind of advice who can be given by the staff, and all kind of aspects regarding safety. Safety of the room itself, security on the windows, and so on. Hygiene, it's about offering an hygienic place to use. People have access to hygienic material, clean and sterile material. This is part of helping to decrease the contamination of HIV. People should not look around for their material. We always provide as much as they need. There is no limit in material. You need 5 needles, you take 5. You need 20 needles, you take 20. You want to give needles to your friend in the street? Fine. Every needle who come out of this room, like any condom, is an act of prevention. And about stress-free, it's very important. The less we limit the stress, the more we promote awareness of the risk. About the basic rules or regulation. Before you enter the program and you sign in, let's say, we want to make sure that you fit the criteria. Criteria are pretty much basic. You have to be a long-term hard drug user. What is long-term, we can argue, but internationally we talk about 5 years of hard drug use. There is age limit. Most of the drug consumption room in the Netherlands would accept clients from the age of 23. In our facility here, because we work with non-Dutch citizens, we lower the age criteria because they have no other place to go. We can start contract from 21 years old, and under 21 years old we can or could, but we have to ask the permission of the direction in case of responsibility. Criterias, and then when you finally sign up for the contract, we expect you to respect the basic rules and regulation which are based on safety, hygiene, stress-free. So now clients sign a contract where it's written, I will behave in accordance to the basic goal of a drug consumption room, and I will guarantee safety, hygiene, stress-free. The professional is not standing outside of the group, because when you are standing outside, you don't hear the signals of raising stress, tension, and it's best to be within the group of users to do a lot of prevention of or bad behavior, de-escalation of conflict, and to regulate the stress-free environment. We are all trained medically to do a first aid in case of overdose and other medical problems. And we have to be trained once a year at least, and we do training about first aid, but we do specific training about overdose. We call the ambulance, we have a direct hotline number from the drug consumption room to the ambulance. We don't have to go via central, so we are directly in contact with the ambulance. We say we have an overdose, and they are in sight within 3 to 5 minutes.
There is a lot of knowledge already in Europe, and there is a lot of expertise. We have mobile drug consumption rooms in Denmark and in Germany, and we have the very new drug consumption room in Paris, which is a medically supervised drug consumption room. So there's very different forms, and in the network we exchange the knowledge which is there, and we provide it to people who are interested in opening up, for example, like you guys in Stigma. In Paris, it took, I think, at least 3 to 5 years to open the drug consumption room. Because they also had the permit to do it, I think 3 years ago, and then suddenly the city said yeah, no, we don't want to do it now. Maybe you should first talk to the neighbors a bit more, establish a good relationship, and then we evaluate that, and if you did that good, we allow you to open. So after 3 years talking to the neighbors, talking to other shareholders, they could open last year, end of 2016, a drug consumption room. The first one in France, 30 years after the first one in the world opened. So it's a long struggle in some countries, but it's always due to the local policy. The same we see, for example, now in Scotland, in Great Britain, that they the Scottish Parliament voted for safe consumption rooms, drug consumption rooms, but all the press is crying and is saying yeah, but you're encouraging people to use drugs, and it is not going towards abstinence. So there also you see a very straight focus on abstinence-minded thinking, which is of course not in the discussion, or which is of course not a debate in drug consumption rooms, because drug consumption rooms don't go into the abstinence discussion, they go into helping people who are the most remote from a healthcare system. And in the end it's a very political thing, because the money comes from the government, and then the politics, maybe it's, I don't know, you have a Christian government and they say yeah, it's not in our ethics to support that. Or every country is different, different backgrounds.
The client has a responsibility. You can never blame somebody else for your own use of drug. For sure, we will always do our best to help somebody or to save somebody. with the first aid, but you cannot be persecuted for trying to help somebody to live. You can be persecuted for trying to kill somebody, which is not the case. That's the opposite logic. A drug user, he has the same rules and obligation as any other citizen. So if he decides to drive his car under influence of alcohol or heroin, it's a crime, and the police is there to tackle crime. We do not promote crime. We promote a responsibilization, hygienic, safe use. It cannot be blamed institution for what happened outside or after drug use. If the staff members estimate that the client is too much under influence of alcohol or has been using already too much, we will ask the client to stop using. That is our responsibility. If he decides to keep on using outside of the building and he dies from an overdose, that's his responsibility. But even if it would happen in the user's room, that's also his responsibility. There are two ways to present and propose a drug consumption room to partners. The first way is to talk about values, ideologies, and the harm reduction concept. That means my hands is on my heart. I talk with my heart. I want to help drug users. I know the consequence of drug using. I know the negative consequence of this lifestyle. Many years in the street bring medical problem, psychiatric problem. So for sure, this is an important aspect. But finally, what we want is to convince a majority of people that the service are cost efficient and therefore also medically efficient. So when I talk with my heart, it's one part of it, but I have to talk with my wallet to the majority of the people to say that finally prevention of one HIV contamination is a reduction of millions of euros for the health authorities, for the health insurance. The reduction of public nuisance makes that everybody is more happy to live together, and it costs less in terms of stress, police force, long-term treatment of psychiatric problem. Anytime we prevent an abscess to appear, we save more than 1,000 euros for the health insurance or for you and me, the taxpayer. So on a long-term plan, the financial benefits are always more than not creating a drug consumption room. This is very simple. One day in prison in the Netherlands costs 130 euro, basic, without methadone, a doctor and a psychiater. If you need all this, it will cost 500 euro a day, and one day in a drug consumption room costs 25 euro.
How do people benefit it? Yeah, first of all, they have a safe place during the day where they can consume the drugs. They have clean materials. They have people to speak to, like social workers, so they can work on not only on the addiction problem, but also on the housing, on finances, on healthcare issues. They have a much easier step. For them, is the threshold gets much lower. They come in, they know the people on a daily basis, they know the workers, and it's like, yeah, okay. After a while, they open up, they work on a trust base, and then they take a next step towards things they need.